Good evening and stay tuned to Channel I as we're ready to bring you another episode of this set of programs where we take a look at the major health issues that you're facing. This is IMED on Channel I. And World Diabetic Day falls on the 14th of November, which is the coming Sunday, and diabetes happens to be one of the major non-communicable diseases, one of the biggest problems that the whole world population is facing nowadays. So we're going to talk about diabetes and about the World Diabetic Day as well. So to do the honors, we do have with us a consultant endocrinologist, Dr. Lanka, who is the president of Sri Lanka Diabetes Federation, public arm of the Sri Lanka College of Endocrinologists. Good evening to you, doctor.
Good evening.
So the diabetic awareness, the access to diabetic care happens to be this year's World Diabetic theme. But first of all, why do they have specifically selected this 14th of November, this date, as the World Diabetic Day?
Yes, it's a very good question because this is a historic year for the diabetes world. As you know, insulin was discovered in 1921, and the two people who discovered the insulin was Professor Banting and Best, one of his students. So Professor Banting's birthday is 14th of November. As an honor, the world has chosen his birthday as the World Diabetes Day, that is 14th of November. So it's a historic year, 100 years of insulin plus this day falling on the 14th, his birthday.
Indeed. Now, 14th of November being the World Diabetes Day, now this entire week is known to be the World Diabetes Week. Why do they have chosen a week, and why have they nominated this particular week in the month of November for diabetes?
It's just to stress the importance of tackling the problem, getting the attention of the public and the authorities as well, because this is before the COVID pandemic came, diabetes was the global pandemic actually. We call it a silent killer. Before the COVID came in 2019 and 18, there were over 4 million deaths due to diabetes. You can see the scale of things, but unfortunately a similar number has succumbed to COVID as well. Now it's a catastrophic event for us, and these 2 years have been, as I always say, clashing of the two pandemics, and those are having effects on each other. The diabetics are faring very badly if they get infected with COVID-19 as well. So it's a very important thing to stress the need, especially in screening for diabetes. Half of the diabetics in the world as of now, we estimate that the World Diabetes Federation estimate that there are 463 million diabetics throughout the world, but 50% of them are undiagnosed. We are going by the numbers when you do the screening. So the importance of screening for diabetes, recognizing the symptoms and treating that, and most of all, our stress is prevention of diabetes, how it's a easily preventable disease, unlike COVID where you can't do much about it.
Yes.
This is a easily preventable lifestyle associated disease mainly. So that's the importance that we are giving to pass the message to the public.
And that happens to be probably the need as well, as especially during this pandemic situation, the access to diabetic care as being chosen as this year's theme as well, probably because of the COVID-19, isn't it?
I think it's very relevant because we had a huge problem initially where our patients could not access the required care, and access for medication was also for somewhat affected. But we managed to overcome that largely by adapting very quickly. The biggest drawback that we saw in Sri Lanka, I'm talking about Sri Lanka, especially in the government sector, in our clinics where thousands of patients are getting treatment for their diabetes, we didn't have electronic patient records. So when the country is shut down suddenly and the clinics are not functioning, and of course we know our patients need insulin. Some of our patients can't survive even 1 or 2 days without insulin, the type 1 diabetics. And of course the people who are taking tablets, their sugars will go up, then they have increased risk of complications and even complications with COVID. So that was a very sort of a tricky situation, and we somehow managed to overcome that through the use of hotlines and the national media. I must thank the media for displaying our numbers, and then the patients were calling in, and the government quickly adopted a method of posting the medication through the postal department
Straight to home.
straight to home. So we can adapt, but if we had a proper electronic records and their numbers, it would have been just a one click sending SMS and getting them to come on different days without overcrowding, and it would have been much smoother. So I think we have to think in a sort of a more to the future in terms of how we can give a proper access to diabetes care to the whole population.
Now, Doctor, turning to back to Sri Lanka, when it comes to the population here in Sri Lanka, and where we see another high number of diabetic cases reported even daily. Now, what do you see, like what do you have to say about the current situation here in the country?
Current situation is not very satisfactory. We see that increasingly the numbers are going up, and increasingly the age is coming down. So you can see what's happening. More and more younger people are getting diabetes, and even the elderly people are having, say, above 60, the prevalence is about 1 in 5 people. And in the highly urbanized areas, the cities, we have a small study done few years back. The prevalence of diabetes in the adults was 27%. So it's more than, very high. But this doesn't apply to the whole country. It may be about 15% when you apply to the whole country, but it's daily it's increasing. So because of the changing lifestyles, change in the dietary habits, the dietary pattern, energy dense food, takeaways, fast food culture, and lack of exercise, and the increasing waistlines, and the childhood obesity is becoming a huge problem. And that's why we see more and more younger people getting type 2 diabetes, which used to be a disease of the middle age,
Yes.
usually. In 1992, the prevalence of diabetes in Sri Lanka was about 2.4%. And by the last record that we have in 2007 is 10.3% in the whole country. Now we know it's much more than that. So that is the situation.
Well, that being the situation now, especially we are having the World Diabetic Day on the 14th of November, and we have this entire week dedicated for diabetes and the diabetic patients in the country. What are the special arrangements happening here in Sri Lanka?
Okay, so we have taken the lead as doctors treating diabetes through the Sri Lanka Diabetes Federation and the other partners that we gather, especially the Non-Communicable Diseases Unit Bureau of the Ministry of Health. We are collaborating with them, and they are helping us with lots of things. And we have education programs for doctors, that's on the 13th Saturday, nurses separately, and a bigger plan with the Lions Clubs and the other volunteer organizations. We are trying to screen thousands of people, but sticking to the health rules, only 100 people in one city. We check for their blood sugar, blood pressure, and the BMI, height and weight. So we are doing a limited health screening to recognize these unrecognized people, plus advise the people, those who have borderline blood sugars. And on the 14th, we are having through the media, we are going to have a seminar or a session to educate the public about diabetes, running for a few hours. That is on the 14th of November.
So how can the general public join these programs? Is it
yes, we'll be. It's through the Zoom or the YouTube channels that we'll be giving. So we'll be publicizing the connections through our volunteer organizations, and hopefully we will circulate that in the social media as well. Hopefully within the next 2 days you should get the links.
And Dr. Malika did mention a specific point that where the youth is more prone to get diabetes nowadays. And how can they come to know, or how can they easily be detected or rather diagnosed with diabetes, type 2 diabetes, or somehow during these days? Will they be symptomatic or will they be asymptomatic? How to diagnose?
The vast majority of young people, especially with type 2, when they are recognized, they don't have any symptoms. Most of the time we see they go for their driving license when they are 18, some of them are diabetic. they go for their insurance cover, or they are going to go for studies or some visa interview, they are found. So that's the trend now. But if you have excessive thirst, passing lot of urine, unintentional weight loss, definitely you should go and get yourself checked. Or recurrent urine infections, or numbness in your hands or feet, some unusual symptom like that, you should get yourself checked. But if there's a family history, it's a good practice if you are above 35 to get yourself checked. When you say checked, it's a very simple blood test. 8 to 10 hours of fasting, and you go in the morning and get a fasting blood sugar done. If you have a value of more than 126 milligrams per deciliter with some of those symptoms which I mentioned, then straight away we can diagnose diabetes. Then of course there are other more sophisticated tests like a 3 months average, what we call as a HbA1c. If it is above 6.5, you could diagnose. In a doubtful case where there is borderline values between 100 to 125, which we call as pre-diabetes, you could do a 75-gram oral glucose tolerance test. Bit of a cumbersome test. You have to drink the glucose and check the blood sugar hourly for 2 hours, and if you get a value of more than 200, you are a diabetic. So it's fairly simple, inexpensive test. You could diagnose diabetes. The value of diagnosing is huge early, because the more you delay, it's the duration of the disease which causes the problems affecting your eyes, your kidneys and the nerves, so on and so forth. So if in a young person, if you detect it early, we could take remedial measures, and even there is this concept of regression of diabetes now. If you are overweight or obese, if you lose 10% of your body weight in young people, we could reverse the diabetes, but not for forever. You know, if you stick to a good diet and an exercise regime, half an hour a day, 5 times a week, you could manage your diabetes only with diet and exercise.
And what's the correct path that if one is diagnosed with diabetes, what is the correct path to whom they should go and get the medicine, and how this treatment process takes place in Sri Lanka?
In the government sector, we have the widespread network of primary health care units, which is healthy lifestyle centers by the Ministry of Health. Any Sri Lankan could just walk in. If you are above 35, you get a free blood sugar, cholesterol, blood pressure and your BMI checked, and they will look at your cardiovascular risk and refer you appropriately to a secondary care or a tertiary care hospital. If you are diagnosed with diabetes, at the primary care level itself, they could start the treatment and then refer to the specialist if necessary. Or if you are on your own, any a private lab should be able to do the thing. Go to your general practitioner and get the necessary tests done, and if they can't manage, there is a referral system. So access in Sri Lanka, I would say, if you are using it properly, it's there always for anybody. And even for a younger person, 25 to 34 years, if you have a family member with diabetes or any other cardiovascular risk factor like high blood pressure or high cholesterol, you will get a free test done through the government system.
And Dr. Some believe that diabetes happens to be one of the diseases that can only be diagnosed or detected in the people who live in urbanized areas with their lifestyles and on. Is it true, or we can see it in different cultures as well, in different parts of the country as well?
Yes. Now the latest, the 2007 the data, if you take the prevalence of diabetes in the western province was 18.9%. In the Uva province, it was 6.8. So it was like 1/3 of the prevalence. So what's the difference? Just as a crow flies, it's about 100 miles across when you take the two provinces. So it was the lifestyle. So that's why I said the type 2 diabetes is becoming a lifestyle disease. So in the Uva province, people are still sort of exercising more healthier diets, and the western province is congested, traffic, all that, and people are more stressed, and the lifestyles are, they're more into fast food, and they don't have time to exercise. They spend a lot of time on the road, coming to work and probably going back home. So these are the issues. So urbanization, work, and these things matter. So we need to, while developing, we need to have a very healthy attitude towards how to balance these two.
Coming back to the pandemic situation, we saw a lot of deaths were reported, especially with regards to the diabetic patients who have been having diabetes and were under treatment for several years. They were detected with more complications as well when it comes to the coronavirus. Is there a particular reason? Is it only the immunity which has been to be the cause of this issue? Or?
No, it's beyond that. I think now the studies have found out this the COVID virus, which is a coronavirus, enters the body through a receptor called the ACE receptor, which is being upregulated in diabetics. So what we see is that if a diabetic happens to get the virus, the preventive methods are the same: your mask, hand washing, distancing, all that. If you don't stick to that, and if the virus happens to get into your respiratory tract, it enters faster into diabetics, and it enters your pancreas as well, and the beta cells which secrete insulin, and it hampers the secretion of insulin, and then your sugar levels go up. When the sugar levels go up, your immunity comes down. We know the high sugars lowers your immunity. So it's a vicious circle, I would say. So there are many ways that the diabetics will be affected. And in Sri Lanka, since you brought up the issue, people who have unfortunately passed away, 54% have been diabetics. And in the above, that is the total number of patients, any age group, and above 60, in Sri Lanka, 74% have been people with diabetes, dyslipidemia, and heart problems. Worldwide, I read in one article that it's about 30% of the people who have passed away, the millions in the world, has been diabetics. So you can realize the importance of how important it is to, taking all precautions, controlling your blood sugars, and of course taking your vaccines. And we have recommended now for people with diabetes and above 60 to get a third booster dose given, which the government has accepted. Please go and get your vaccines as soon as possible until we find a good medication for the thing. Vaccine would be the only protection, plus all other methods of improving your immunity naturally and otherwise.
Unfortunately, if a diabetic patient will get COVID, if they become positive with the virus, what is his or her situation? Whether he or she should be afraid, or whether he or she should attend to the hospital and get the normal COVID treatments, or will it be different from other patients?
No, we go by the symptom severity. That is very well laid out. We have the guidelines, whether it's a diabetic or not. Please don't stop your medication. All the diabetic and the hypertensive medication, what you are on, even your aspirin, everything, you should continue the medication unless specifically told by your doctor not to take it at a particular time. So if you have severe symptoms, of course you have to go to the hospital, but inform your local doctor, the PHI or the area MOH. They have laid down guidelines very clearly, whom should we manage at home. And of course our SLMA has a 247 hotline where the doctors are available 24/7 to advise you whether you should go to hospital or not. So all those services are now very well developed, and I think during the August period, the peak, that functioned very well and managed to reduce the complications a lot. So it's like a normal person, depending on the severity and whether you are short of breath or not, you should seek medical attention. All will need not be admitted.
And doctor, how was the prompt towards the post-COVID symptoms, and especially when it comes to the diabetic patients, the complications post-COVID?
Yes, that's a very good question. Now these days, that's the COVID has fortunately gone down a bit, but it's not out. So everybody has to remember it's still dying embers. Anytime it can flare up. But now we see increasingly post-COVID, those who didn't receive any steroids also, there is increasingly new diabetes we are recognizing, and people who have had diabetes, their control has been, the sugars have gone up. So I think there's a connection between this virus and damage to the beta cells. We are seeing younger people getting diabetes and coming with symptoms after getting COVID without any complications of COVID.
So is there a particular way to get rid of these complications, or especially when it comes to the post-COVID symptoms?
Yes, so post-COVID also, I told you there is an underlying cause, but that is pushed by your lifestyle when it comes to diabetes. Although you are genetically predisposed or you are having a problem with the infection, if you control your diet, reduce the high carb diet, sugars and fats, and if you exercise regularly, and if you are really a stressed person, reduce your stress levels, you could always avoid getting diabetes.
Turning back to the this year's theme of the World Diabetes Day, access to diabetic care. Now, what do you see, doctor, especially in a developing country like Sri Lanka? What are the areas that it should develop more when it comes to the diabetic care?
Yes, I think the crying need, what I felt as a clinician looking after these patients, is that we should have electronic health records. I think our ministry also will be looking at it. If we had a good database and with all the connections to the patients, we could have done a much better job in a crisis situation. And we could have used technology in the form of apps and telemedicine. These are new areas,
Yes.
which has, I think, developed also during the last year or so greatly, even in Sri Lanka. So we have to look to the future. I think it's a blessing in disguise that these things came up. So we have to look at electronic health records and specific diabetes apps and technology-based solutions, where the patients also don't have to rustify in our clinics to trying to get the medicine, spend half a day in queues and all that. We could minimize all that and improving the access to diabetes care in future.
And finally, Dr. Now, since we are having this special program also targeting the World Diabetes Day as well as the World Diabetic Week as well. So finally, to our viewers who are having diabetes, or whether they are diabetic or not, or their family members, their friends and all, how to prevent, and what is the message that they can take home from you?
Yes, so in this special situation, we are still in the middle of two pandemics clashing. So please take care COVID-wise. Don't relax. Please take all the precautions, because you might see another wave if we go on like this. Plus, of course, managing your diabetes, taking your medication regularly and sticking to a healthy diet and taking the doctor's advice and regular exercise would be the easy way out for a healthy and a happy life without diabetes.
That's a very good message indeed, especially during this pandemic situation, where we need to get more focused on our health, on the pandemic, as well as these kind of silent killers, we call it, diabetes. So today we thank you, Dr. Manilka Sumanathilaka, consultant endocrinologist, the president of Sri Lanka Diabetes Federation, for being with us on IMED and giving this information, passing on this message to our viewers today. Thank you, doctor. Thank you so much.
Thank you very much.
And then we invite you to join another episode of IMED next week as well. Take care. Have a pleasant week.